to the 2021 Telehealth Summit brought to you by the California Telehealth Resource Center. We're glad you could join us for today's session on tools for remote patient monitoring. I'm Erin Hickman. I'm a pediatrician and clinical informaticist, and I'm your moderator today. We invite you to turn on your video for a more interactive experience. Today's session is purely for informational purposes. The California Telehealth Resource Center has no relevant financial interest, arrangement, or affiliation with any organizations related to commercial products or services discussed during the Telehealth Summit. Before we begin, I wanted to review a few tips for the Zoom platform we're using today. At the top right of your Zoom window, you can toggle between speaker view, which will show you just the video of who is speaking, or gallery view to show all the participants with video turned on. Closed captioning is enabled. If you would like to view subtitles or a running transcript in a separate window, you can access them via the live transcript icon on your Zoom control bar. Today's session is being recorded. It will be posted on the CTRT YouTube channel next week. Lastly, please feel free to post your questions in the Zoom chat window. We'll hold the last 10 minutes of today's session for Q&A. The presenters today had indicated that they would prefer chats at the end, so we will hold all Q&As until the end. With that, I would like to introduce our guest speakers today, Doris Barta and Jordan Berg from the National Telehealth Technology Assessment Center. Doris is the director of the National Telehealth Technology Assessment Center, also known as TTAC, one of two national telehealth resource centers. TTAC provides in-depth objective assessments of telehealth technology and publishes the results of those assessments on their website. TTAC also provides technology showcases at regional TRC conferences throughout the US. During the COVID crisis, had provided the showcases virtually. Mrs. Barta has worked in the telehealth field since 1992, serving in the capacity of a telehealth network director, as well as in the role of fund development for telehealth. Through her wealth of experience in program planning and operations, Ms. Barta continues to assist healthcare organizations, networks, and providers implementing cost-effective telehealth programs serving rural and medically underserved populations, with a special emphasis on program development through shared training and expertise. Jordan is a technology assessment specialist at TTAC. Jordan obtained his Bachelor of Business Administration and Management Information Systems from the University of Alaska, Anchorage. Jordan has over 13 years of hands-on experience working with the Alaska Tribal Health System, with 10 years working in telemedicine, both in programmatic and technical roles. Jordan is passionate about working with people, helping them to understand, evaluate, and assimilate telemedicine technology. Doris and Jordan, the floor is yours.
Thank you very much. Can you all see our PowerPoint presentation?
Yes.
Jordan? Okay, great.
Yeah.
So Jordan and I are pleased to be able to talk with you today about remote patient monitoring systems. To give you just a little bit of history about who we are, as was indicated, we are the National Telehealth Technology Assessment Center. We are federally funded through the Office for Advancement of Telehealth. We provide technology assessment services to the 12 regional TRCs, one of which CTRC is one of the regional ones out of California, and the other national TRC, which is a policy TRC, also housed in California. So between the three TTAC staff, we have Garrett Spargo, who is looking into Jordan's eye there, and Jordan and myself, we have over 50 years experience in telehealth. So some of the things that TTAC does is we provide a lot of evaluations and toolkits on our website. So we really, recommend that you go and take a look at our website. Some of the key toolkits that we have are a clinician's guide to video platforms that was narrated, and there are numerous video clips there by a clinician. We have the Technology Assessment 101 toolkit. We have a direct-to-consumer toolkit. We did an assessment of video platform platform connectivity, and there is an video of that you see there with Garrett in it, with several video platforms all going at the same time. So it gives you a nice comparison, side by side comparison. This past year, we did a video otoscope evaluation, and then we also developed a pandemic response plan project that talks about how people geared up for and used telemedicine during the pandemic. TTAC does a lot of outreach. One of the things that we did over the last year is we filmed some tech talks with the TRCs. This is just an example of 2 of them that are on our website. They're videos where we had experts in the field talk about the various technologies, one of which is the remote patient monitoring with Kathy Wibberley, who is a Matrix TRC director, and Jonathan Neufeld, PhD, who is a behavioral analyst, who is also one of the TRC directors. So we also do the tech showcases. Now, normally we've been to your conference several years and brought the technology showcase with us. However, over the last 2 years, because of the pandemic, we've not been able to come in person. So we've conducted virtual showcases. But the showcases give you guys, the audience, an opportunity to look at the technology and compare it side by side and get your own feel for what the technology is and what your thoughts are related to the technology. Because we are federally funded, we are vendor neutral. So it gives you an opportunity to play with the technology, and all we do is provide you with the data about the technology that we know. We are members of the National Consortium of Telehealth Resource Centers. All 12 regional and 2 national are members of it. This gives you a breakdown of the states and the regions. This is actually an interactive map from the NCTRC website at www.telehealthresourcecenters.org. All you would have to do if you're from the California region is click onto that California icon and it would pull up the staff information. If you're from any one of the other regions, you could do that as well, and that would pull up the information on those people. If you're interested in talking to one of the 2 national TRCs, all you would have to do is click on to their icon, and that would bring you to one of the 2 national TRCs. Now, we all work very closely together. So many times we may give Aislinn and the staff at your TRC a call to talk to them about a question that we'd received from a person seeking technical assistance. And so the really good thing about the National Consortium of TRCs is that you're getting everybody. You're getting the expertise from the whole nation there. So today what we're going to do is we're going to talk to you a little bit about remote patient monitoring technologies. We're going to talk about what some of the concerns are with regards to remote patient monitoring, and for example, what are some of the peripherals that are engaged with those? Jordan's going to do a presentation for you on that. We're going to talk to you about remote patient monitoring hubs. We are going to discuss some business models that you may want to consider when you're doing remote patient monitoring. TTAC did an evaluation of RPM systems, and Jordan is going to be reviewing that information with you. We're going to talk with you a little bit about remote patient monitoring trends and what we've seen happen over the most recent period of time, most specifically the most recent 18 months, as we've moved more and more into providing services to the patient in the home. And then we're also going to talk with you about some things that you may want to consider when you're developing an RPM system. So now here we have a video that we're going to, just a brief animated clip that we're going to show you about remote patient monitoring. And I have a script here, so let's hope it all works perfectly. So remote patient monitoring systems allow the patient to submit vital sign information for review by the care provider. The benefits come from tracking patient readings over time and looking for elevated or critical values. If concerning values are detected, the system alerts the provider who can contact the patient for intervention. This allows changes to be made to improve patient health at the earliest point of concern and with the most efficient intervention. A secondary benefit of RPM solutions is that they allow patients to have better engagement with their data, and they can see the impact of the changes in their lifestyle and medications. Now, typically patients are enrolled in a cohort generally broken down by disease state, such as hypertension or diabetes. A provider or group of providers can manage the readings for the patient's disease state cohort. These cohorts generally run between 30 and 90 days, but they can vary depending on the needs of the program. So now Jordan is going to talk with you about the components that you might find in an RPM kit.
Thanks, Doris. So one of the things that we want to talk about is there's a lot of variety as to remote patient monitoring platforms, what they do, kind of how they do it, and the different peripherals that are included. But in general, we can break down most RPM platforms into three kind of key components. This has changed a little bit in the recent time, but in general, this is kind of a good framework for breaking down an RPM device. First is peripherals. Most RPM solutions are going to support some sort of peripherals, and we'll talk a little bit more about the specifics on those peripherals. These are used to collect the patient's information and to put that into the system. A second component that is common to most RPM platforms is a hub. Peripherals will collect the information, but the hub gathers this information together and then sends it off to the back end for monitoring. Hubs can look like a variety of different form factors, and we're actually seeing a move towards remote patient monitoring kits that don't necessarily have a hub. And we'll talk a little bit about how that technology works. Finally, a key component for these platforms is the provider portal. And the provider portal may look like a web interface where a provider can log in, manage their patients, look for alerts, and do some other administrative functions. So let's talk a little bit about peripheral devices. Peripherals used in RPM can vary, but there's generally going to fall along some key common peripheral types. One of the ones that we see the most commonly is blood pressure. So blood pressure cuff that can be placed on the patient's arm, so we can take readings for hypertension, congestive heart failure, some of those common disease, RPM disease states. Blood glucose is also a very common peripheral that's used in these platforms. SpO2 or blood oxygen monitors are a common peripheral. Scales are very common as well. So a scale that can be connected and put in those weight readings to note weight fluctuations over time. Another peripheral that we see fairly often, but it's not uniform on all platforms, is a thermometer. So some sort of thermometer for measuring temperature over time and monitoring for temperature changes. That's a less common of a peripheral, but it is one that we see. These peripherals are going to connect with a variety of different transmission methods. By far, the most common platform that we see, or most common connection method that we see for connecting these peripherals to the hub, is Bluetooth. Bluetooth is pretty ubiquitous for most of these. One of the things that happens is if a kit is set out to a patient, most of the devices will be connected via Bluetooth prior to them arriving at the patient's home, or in situations where there's not a kit with a tablet and the patient may be using their own smartphone device, that pairing happens through an app. Generally. So this allows the Bluetooth to kind of be connected and pre-connected. It's not bulletproof. Any Bluetooth device is prone to disconnecting, and there can be steps that a patient has to take to recombine or to reconnect. We do note that there's a rise in peripherals that are actually using cellular connectivity from the devices themselves. And we'll talk a little bit more about this a little bit later. Where the SIM card, there's actually a SIM card inside the device and an antenna that allows us to actually transmit the results directly from the blood pressure monitor or directly from the glucometer. And this allows us to connect without having to go through the wireless or through the patient's cellular connectivity. We do see that there are some peripherals that connect via USB. This is the most common in glucometers. So glucometers, many glucometers have the ability to download logs via USB. And when we're deploying these RPM solutions out, most patients are familiar with, if you're working with diabetes management, many of these patients already have a glucometer that they're used to using, and they'd like to use the glucometer that they feel comfortable with. So functions like this allow us to download the logs from those glucometers and add them to the RPM solution. This is a fairly uncommon connection method. For a lot of those, instead of actually connecting via USB, they would do a manual entry where they would just take the reading on the glucometer and then enter that reading through the tablet or through their phone app. Moving on, we can talk a little bit more about some of the features that we're seeing in hubs. As we move to either a patient-generated cellular device or a tablet, and as these become more and more powerful, we're seeing more and more features built into the hub technology for these RPM technologies. Most of the time, these platforms are going to be focused around some sort of tablet. We've seen that a lot of these tablets tend to be Android-based tablets because there's a lot of flexibility in setting these up, customizing the UI. There's the ability to lock them down so that you don't have patients watching Netflix on their RPM tablets or using them for playing games. But you can take these tablets and really customize them so that they're performing the use case that you want and not much else. We are seeing a big trend towards BYOD. So when we say BYOD, what we mean is bring your own device. And the idea behind this is that most of the population has a smartphone device and they're comfortable with using these. So if we can utilize these smartphone devices, we have the ability to lower our deployment costs in that we're not actually having to provide the tablet, we're not actually having to provide that hub. And we can use the customer's device and something that they're already familiar with using. The benefits of this is connectivity. So we're actually able to use the connectivity that's built in to that smartphone device, whether that's wireless or cellular. Some of the challenges around this is that we have to have a mechanism for pairing the different peripheral devices that we send out to these devices. And most of the time that happens through the app. So when a patient receives their or when a patient is enrolled in a program, they'll download the app for that appropriate, for the kit. They'll log in with a username and password, and then those devices can be paired with that app so that when a patient logs into the app, the devices should be paired. And again, it's not exactly bulletproof. Sometimes you have to go in to the device, look through the Bluetooth settings, and actually make sure that those connect. Another type of hub that we're seeing more and more common, if we can go back one more slide, is device-based SIM. So we're actually seeing, like we mentioned previously, a lot of devices that are, the SIM card's in the glucometer, or the SIM card is in the blood pressure, so that we don't have to worry about connecting the patient's device. We don't have to worry about what the wireless is like in the patient's home. There are platforms that use just hubs. So you can see the two units there that kind of look like the hockey puck. So those are designed for the devices to connect to directly and to transmit the information. There's no interface for interacting with the patient with a platform like this. So the readings just take the information, transmit it to the cellular or Wi-Fi hub, and send those off. We're seeing fewer of those as most organizations are kind of centering around a platform or a BYOD model. Connection types for these sorts of platforms are either Wi-Fi, cellular, and we do see some that still support phone line-based connectivity, so that you're able to connect a phone line and just transmit the data. But again, most of them are connecting either via Wi-Fi or cellular. On the next slide, we're going to look at some of the additional features that these hubs can start to support. As more and more powerful platforms for these devices, either BYOD or the Android tablets or PC-based, we're seeing more embedded video features inside of these platforms so that not only can the provider monitor the readings, look for alerts, but they can actually reach out through that device and have a video conversation with the patient, talk to them about readings, see kind of if there's something that's changed in their lifestyle. Another feature that we're seeing in these platforms is the increased use of chat so that the providers can actually have a asynchronous conversation with the users where they actually send information through the app and actually have that interaction with the patient via chat instead of via live video call. We're seeing more and more sophisticated reminders and alerts being sent through these platforms. And we're seeing more and more emphasis on how the data is being presented to the patient. For early RPM platforms, it was there was very little information about the readings that were shared with the patient other than maybe a log that they could look through. But we're seeing more and more sophisticated data presentation for the patient to kind of consume. A big change that we're seeing within these hubs is the inclusion of patient surveys in education. There's a wide variety of different types of surveys that can be built into these platforms. These allow programs to build custom or to use pre-existing surveys, materials, and that can range from dietary counseling, behavioral assessment, pain comfort scales, and varieties of custom options that organizations can build into these platforms. Almost all the RPM platforms that we looked at, all the RPM vendors that we looked at, had either integrated as a engagement platform like this or engagement features like this, or we're looking to do something like that in the near future. On the next slide, we're going to talk a little bit about the third component in an RPM platform, and that's that provider portal. As we saw in the video, that the provider portal provides a way for the provider to really manage and see kind of what the results are as they came in. It's really the most vital element that an RPM solution that the provider is going to engage with. Generally, they're web-based, where a provider would log in with their credentials. They'd be able to see the patients that they're managing on the platform. They'd be able to see as alerts came through. And then they can also do logistical management. So if they want to add a new patient to the program, they want to send out a kit to a patient for programs that have the device fulfillment set up through the application, they could do that through that provider portal. The reporting and integration elements actually happen through the provider portals as well. The level of EHR, EMR integration a program can support, it was going to vary very significantly based on the platforms that we're using. What we're seeing is a trend in RPM solutions for an RPM solution to have a high level of integration with one or two of the really common RPM platforms. A case in point example, we looked at the Raziel solution, RPM solution, and they had a high level of integration with the Cerner Millennium platform, meaning that if you were to invest in the Raziel solution, a lot of that integration would happen kind of out of the box. So you could get the alerts, you could get the patient migration and have that information go into the platform and back and forth. So if you look at the RPM solutions that are already supported by your EHR, you can find solutions that have more in-depth integration. That doesn't mean that these platforms can't integrate outside of those solutions as well. So almost all platforms are going to have either HL7, Smart on Fire, some sort of integration that they can build into the system. And that can range from just exporting basic PDF reports that you can include into your EHR, patient demographic information that can be sent back and forth through the system, or something more complicated like actually having the alerts trigger messages through your secure messaging system. So there's a lot of customization that can be done. The cost for those and the support for those, if you're having something custom done, does go up, and it does build delay into actually being able to deploy the RPM solution. Next, we're going to have Doris talk a little bit about some of the business models that are commonly supported by these RPM platforms.
Thanks, Jordan. So in general, when you're looking at RPM solutions, most RPM vendors will support one or a combination of these services. So device sales, that's when they only sell you the hardware. They do not do anything else with the technology. It's just a one, here's your equipment and good luck. A fulfillment vendor will provide logistical management of the hardware to and from the patient's home. And many times this is real important. And some organizations have told us that, they order it in the EHR. It's an alert to the vendor ships the equipment to the patient, and then the vendor gets the patient set up with the technology. So that takes part of that out of the hands of the provider and allows them to do what they do, and that's provide patient care. Then the service provider is one that will also monitor the services for alerts, and they'll manage your data too. So they'll manage a trending report for you and those kinds of things if that's kind of vendor that you want. And then some of them will also do billing and reimbursement for you. So as we all know, CMS has made significant changes in reimbursement over the last 18 months. And RPM services is also one of those that they've changed their reimbursement structure for. So many vendors will help you with tracking and billing of those services because they stay on top of that because that helps with their business model. So this graphic here demonstrates a trend that we've noticed with RPM vendors. In general, the vendor seems to have approached RPM from either a technology or a workflow care-based or a reimbursement model. Now, most of the vendors seem to be stronger in one of these three focuses, but many of them are making strides to move forward so that they are providing services in other areas as well. So now Jordan is going to provide you with a quick demonstration of two of the technologies that we have done an evaluation on: the Vivify Health Pathways Kit and the Livongo Kit.
Thanks, Doris. So like Doris said, we've got the Vivify Pathways unit, and we've got a Livongo kit that we're going to be showing for you guys today. And we're going to walk you through some of the features on this platform. Now, the reason we chose these two kits is they're kind of on slightly opposite ends of the spectrum in terms of a couple different features. One is on multi-disease versus kind of single or a select disease state monitoring. And the second is on bring your own device or cellular-based technology inside of a device versus a kit with a hub. So the first device that we're going to look at is the Vivify Pathway unit. Now, this can be pretty highly customized depending on what your use case is. The kit that we're looking at here today has the Android-based tablet like we were talking about. The UI and the setup for this is highly modified so that you really can't do anything besides look at your alerts and kind of walk through the workflow. The Vivify Pathways supports a variety of peripherals, including the blood pressure cuff that we see here. There's a glucometer, we have an SpO2, and then we have a Bluetooth scale that actually works with it as well. Inside of the application, we can see there's several different functions. If we kind of go in, we'll first be asked to log in. One of the things that you'll notice here really quick is that pretty much all of the interactions we have with the device are going to be narrated. So it's actually going to talk to us and kind of tell us what to do. And that's one of the things that we find for the kits that have the built-in tablets is there's
please enter your password.
Is that they do this kind of narration where they walk you through the different steps and that they kind of annotate everything for you. So we're going to put in our password.
Welcome to day one of your remote monitoring program. Are you ready to begin?
And the first thing that it's going to do is it's going to walk us through one of these patient engagement surveys. And we're going to walk through that together. We're probably not going to do the whole thing, but we're going to kind of show you what this looks like. So yeah, we're ready to begin our...
Yes. Have you felt fatigue over the past 24 hours?
You can see the types
Yes.
of questions that a platform like this
While
might
at
ask.
rest, how has your breathing been?
One of the things that is noticeable is
No trouble breathing.
for a lot of these
Did you take all
platforms,
your medications today?
we kind of wish the alerts and the voice that they were using. So they're using the built-in Samsung voice for these platforms. We wish it was a little bit less robotic and a little bit more soothing. We've heard from some of these RPM vendors that they are looking to kind of make these a little bit more conversational, or that they're working to get them integrated with something like Alexa or some other speakerphone device that will engage with patients a little better. We took our medication
Yes.
today.
Please watch a short video on tracking your symptoms.
And it provides
Later.
us, us with a little video that we can watch.
In treating your heart failure, you are one of your doctor's most important.
And we're gonna skip through that real quick.
It's very important to track your symptoms every day to help your doctor take care of you.
It gives you a little quiz so that you can make sure that the user
True.
is listening to the education materials. That's a correct answer.
Please place cuff around upper arm for blood pressure measurements.
And then it's gonna walk us through the different readings that we're supposed to do for that. So we're actually gonna go ahead and do this little blood pressure measurement and watch as that reading kind of goes into the system. So I just put the cuff on. We hit the button here, and the advantage of having a system like this is everything should be paired out of the box. There should be very little I have to do as a patient to set this up. I just kind of go through and I just respond to basically what the device is telling me to do. If I don't respond to what the device is telling me to do, it will make an alert that comes out really frequently just to say, hey, you need to do this, you need to do this, you need to do this. Having that constant reminder can be a very helpful thing in making sure that we're getting these results to patients. Guarantee you my blood pressure is going to be high because I'm presenting. A few seconds
Yeah, I was
here.
thinking, Jordan, you need to go to your doctor right after this is over.
Yeah, maybe. Also doesn't help that you're talking. You're supposed to be quiet. But we want to avoid some dead air, right? Oops. That is very high. Okay.
Blood pressure is 188 over 120.
So we're going to go ahead and
Your
submit
blood
those
pressure
results.
is abnormal. Please wait to retake your blood pressure.
Okay, so and it's probably abnormal because I'm under a little bit of pressure because we're doing a live demo. So what we're going to do is we're actually going to go to the next reading here where we're going to do
Please put pulse oximeter on your
a
finger
pulse
for measurements.
oximetry. And we just go ahead and set that up. It's actually going to take the reading.
Your oxygen is 96%. Your pulse is 88.
And as you can see, it's all kind of connected out of the box, and it just kind of goes ahead and takes it. So we're going to go ahead and submit that reading.
Please place cuff around upper arm for blood pressure measurements.
We're going to skip the blood pressure reading for now. I can also go in and put in manual readings as well. So I can go into the scale.
Please stand on your scale for weight measurement.
And I could do it either via the scale. I could use the Bluetooth function, or I can
Please
enter in a
enter your
manual.
weight measurement.
Most
Your weight is
platforms
200.
are going to have a
Please place cuff
functionality.
around upper arm for blood pressure.
And as you can see, these alerts are pretty insistent. So it's going to definitely talk to you. So that kind of demonstrates what a patient experience might look like with one of these platforms. So we're gonna go ahead and look at the next platform that we have here. And I would describe the Vivify as kind of your full feature. It does all of the kind of the vital readings that you'd be concerned with. The next one that we're going to look at is the Livongo, and it's a little bit more of a targeted kit. Where there's a few different peripherals that they have, but it does a few unique things with these platforms that we want to kind of highlight. The first thing that we should note about the Livongo kit is that the peripherals in the kit have SIM functionality built in. So we've got 3 different peripherals. We've got the blood pressure monitor, blood pressure kit here. We've got a glucometer, and then we've got the Bluetooth scale. And all of these devices have SIM technology built in. So they have a SIM card, they have a little wireless antenna, and they're actually able to send these results right from the device. So that means that we don't actually require a hub. We don't need a separate device. We don't need to connect these to our wireless. And it also means that if we've got a patient that we want to just monitor their glucose, or we want to just monitor their blood pressure, we can send them just the one device, and there's no other setup or functionality that we need to do. That said, we can connect to an application and look at the results as they come in. So it has elements of both just a SIM-based, that the results get sent off automatically, but we can also, pardon here, I just had this up, there we go. We can also look at the results as they come in through the application. So we don't need the cell phone in order for this product to work, but we can use it to monitor our results, watch our trends, look at logs of results. So we can look at logs of our blood sugar, or we could look at logs of our weight. But I want to show you kind of how this works. So the one that we're going to demonstrate first is the scale. So I'm going to take the scale here. I'm just going to put it on the floor. I step on it, it takes the reading real quick. And then what we do is we'll just put this up here, and you can see as it processes the weight, it's going to take a second, and then we're going to see it actually sync and start to transmit those Bluetooth results. So we'll get a little notification here, and you can see that little kind of figure 8 pattern that it's running there. It's actually activating the Bluetooth SIM card, or is actually activating the SIM card and device, and it's going to transmit this right from this device. Same thing with the blood pressure cuff. We would take the reading with the blood pressure cuff. It would activate the SIM. For this kit, one of the key functions is the glucometer. So the glucometer not only works as the glucometer, obviously, but it also works as kind of the interfaces that patient can engage with their data. So through the glucometer, we can look at logs, we can get support, contact one of their coaches, we can reorder strips or other materials for the device. We can actually use this to send messages and to receive alerts about our readings right from this, just this device here. So, if we wanted to just have a glucometer program, we could do pretty much everything even without a mobile device, without a cell phone, right from this device. Gives you a lot of flexibility, but one of the challenges that we find with cellular connectivity is for very rural locations, having these SIM-based devices can be expensive, and or the connectivity for these platforms in very rural locations may not be kind of up to snuff. So you may have locations that just don't work. Most of these will kind of have wireless that you can use as kind of a fallback position, but then you're kind of in the position of maybe having to walk a patient through how to connect wireless, how to make that device work in that situation. So that's kind of the live demo that we wanted to do for you today. We wanted to show you kind of two opposite end spectrums of what you can get in some of these RPM platforms. Back to you, Doris.
Thanks, Jordan. So now we'll get Jordan just a brief interlude here. What we want to do is talk with you a little bit more about the remote patient monitoring platform assessment that TTAC conducted on 6 different RPM services. So Jordan is going to discuss some of the details of that assessment.
Thanks, Doris. So like Doris had mentioned, we did a recent evaluation of 6 different RPM platforms. We were looking for kind of a wide variety of criteria that we were hoping to assess with our RPM evaluation. Sorry, one moment here. Some of the criteria that we were looking at were ease of use, reliability, peripheral accuracy, and then kind of what that business model and sorry, one moment here. We wanted to look at business models and the usability and data presentation, both for providers and for customers, ease of use, and device accuracy. So what we did was, on the next slide here, we did spot checks of the different peripherals, including SpO2 devices, blood pressure monitors, glucometers, and scales included in the kit. One of the things that was kind of surprising to us was that in general, all the devices were fairly accurate within the tolerances indicated by the manufacturer. So in general, that's plus or minus 3% of what the result reading that we got from our control device. So the peripherals performed pretty admirably, even though we felt that some of them were a little bit on the less expensive side. And some of them we thought maybe wouldn't hold up to long periods of use, kind of on a daily basis in a home environment. One of the big issues that we did find was around connectivity. So we experienced connectivity issues with both Bluetooth connectivity and cellular devices. So for the Bluetooth devices, we found that peripherals would just periodically have to be reconnected. So even though it was supposed to connect to the tablet or was supposed to connect to the BYOD device, sometimes they would become unpaired and the readings wouldn't go through, and we would have to either walk through the app to do a repair, or we would have to go into the system settings for whatever platform we were using and reconnect those manually. And that's not uncommon for Bluetooth devices. That's something that we kind of expect, but for a patient, it might be something challenging that they would have to kind of navigate, and something that might result in support calls to your monitoring staff and kind of having a plan for how to deal with that. For cellular, we found that for locations in our area, which was Anchorage, some of the devices just would not connect. Even within the same kit, if we had multiple devices that were cellular, maybe the blood pressure cuff would connect, but the glucometer wouldn't, or maybe the SpO2 would connect, but another device would not connect. And for some of these kits, we actually contacted the manufacturers. We kind of walked through some troubleshooting. Their advice to us was, well, if you carry the device around, we may be able to find a location where the cellular is better able to connect, and you can kind of send these off, which for a patient that might be viable, or that might not be a viable option. One of the big things that we found was that most of the platforms had offerings either for a home kit or a bring your own device. And the home kits were tended to be focused on more chronic patients with multiple disease states that were wanting to be monitored, and for patients that the structure, being able to walk them through and really simplify the process for them. For the BYOD, these were generally for maybe a single disease state. The interactivity for the BYOD devices through the mobile device, the alerts were coming through kind of where they see the other alerts. There was a lot more ability to kind of see charts of the data that was being entered into the system. So there was a lot more interaction with the bring your own BYOD devices. For the kit-based solutions, we did notice that a lot of them were using kind of older tablet devices, so older Android kind of tablets, and that the Android tablets that we looked at for this review were similar to reviews that we've done in the last couple of years. So there's not been a big change in kind of the hub devices that were being used for the platforms, and even in the peripheral devices. So a lot of these were using some of the same technologies we've seen even 2 or 4 years ago. So it would be nice to see some of these platforms kind of update some of these peripherals. In talking with a lot of these platforms, there is interest in engaging with more and new peripherals. For example, like continuous glucose monitors that use the patch, so that you can monitor right from the device. A lot of them are interested in engaging with these new peripherals, but it can be a complicated process to integrate a new peripheral into these platforms. The other thing that we found is when we were doing our business model review, there's a wide variety of business models, wide variety of payment models for kind of how these organizations approach how these platforms are kind of processed into your business model. So it was really, really hard to compare apples to apples and say, this device costs this device costs this device costs that. So those were kind of some of the key findings that we found within our overview, within our review. Back to you, Doris.
So, so the other thing we noticed was on some of the trends that the RPMs had. And so Jordan has talked to you about quite a bit of this. We realize we're getting to the end of our time with you, and we have several questions. So we're just going to rapidly go over this in the next few slides so we can get to the fun part for you guys, and that's the Q&A. So we saw, of course, that there was a rapid deployment of technology in that 18 months. A lot of focus was on reimbursement. CMS helped a lot with that because they changed a lot of their reimbursement structures that allowed for patient care delivery in the home, and chronic care management, reimbursements codes created opportunities to make these viable solutions. Jordan talked quite a bit about BYOD kits, and kits, and then the various peripherals. And then we discussed the patient engagement, how important it is for that patient to be able to have some engagement there. So when you're considering an RPM device, as you embark on providing these services through your healthcare organization, we just have some key takeaways that we think you should consider. Maybe it would be best to pilot test an RPM solution first, and most vendors will allow you to do that. RPM systems, as Jordan showed you, have a lot of moving parts, and workflow considerations are key to managing the patient population. So it may be beneficial to do a pilot test for a disease state or a group of patients. And then once you get more familiar with it and you kind of work through the bugs, then you can expand that program. Jordan talked quite a bit about connectivity, especially in rural communities. We definitely see where there are some issues as it relates to Bluetooth and cellular connected device. So you really, especially if you're going into an area that doesn't have good broadband coverage, you really want to take a look at how that system works for you. And then you also want to take a look at how your data is being managed, and decide how you want to manage that data. When you're looking into your RPM solutions, you want to make sure that it will work collaboratively with your electronic health record. That can save you a lot of time, money, and headache on the front end if you look into that before you try to integrate the system and it doesn't work with the current EHR system that you have. You'll also want to take a look at how the solution provides data back to the patient. As we talked about earlier, it's real important for the patient to have buy-in to their own healthcare and how their data is managed. So we want to make sure that there's an easy to read interface that shows readings over time so the patient can be more engaged. Now, this is how TTAC can help you. You can get a hold of us by contacting us at our website, www.telehealthtechnology.org. We have a request technical assistance form. We recommend that you get a hold of us through that and you fill out that form. We're in Alaska time, so that's 4 hours behind the East Coast. So we will get to you as soon as we can, and we'll be able to answer your questions. Many times we respond via email. Oftentimes we'll schedule a video call with you and your colleagues so that we can provide you with the best answer possible. So at this time, we would like to thank you for giving us the opportunity to serve you, and we are ready to start answering your questions.
Thanks so much, Doris and Jordan. That was an excellent presentation. I think in the light of COVID, there's been new conversation and new energy around patient engagement and remote patient monitoring. So after looking at the chat, I kind of linked things. First, there was a call up by Yami that I just wanted to summarize that, he also kind of vibe with you on the fact that, Bluetooth can be difficult, especially with bring your own devices. So I think that's a challenge that everybody is struggling to kind of find a great answer to. Meg Bowen had mentioned that something that can help with remote patient monitoring and these devices is really having guides and tools to help patients. So if you're not available at the 2 a.m. hour, they can try to figure out, how to get from end point to B. And then there are several questions about the demo that you gave, Jordan. So I just wanted to call some of those out. So first from RJ, he was asking, are IVR prompts text on screen or video translated for LEP population? And RJ, if you want to add to that, feel free to take yourself off of mute.
Well, and while we're waiting, what we found was that most of the platforms were just using the built-in text-to-speak functionality. So they were using, for the Android-based tablets, they were using the Android kind of built-in screen readers to put in prompts. So it was basically just kind of reading what the prompts were on the screen and kind of reading that out to the patients, and then making alerts for when a time came to do the reading.
And RJ, did you want to add to that? I saw you turn your video on.
Sorry about that. Yeah, no, it just we had a previous presentation, about equity and access for populations of non-English speakers, and these devices are great, but it leaves off a huge swatch of people that may not be comfortable utilizing it in their non-native language. So just was curious on that regard.
We found several vendors that were able to that supported multiple languages. Some of the common ones were Spanish and and I'm going to space on this. So that we did find when we were working with the vendors that there were multiple language support for some of the platforms. It varies a lot from platform to platform as to kind of what level of translation they had. Most of it was just the text. They were just translating the text, maybe not the audio prompts. And a lot of them were providing ways for organizations to upload your own content. So if you had a video, you could actually upload that for a particular patient population. But it was very hit and miss as to kind of what was being supported and who was supporting it.
Thank you.
Awesome.
Appreciate it.
Yeah. I had a great question from Gayani as well. So in light of the remote patient monitoring, she was asking, like, do the health centers have like a first line of triage, or is it kind of, does all this data usually hit the provider?
No, and
kind of adding to that.
I'll take that one. The last thing we want to do is over inundate our providers, right, with data that may not even be necessary for them to have. So what we've seen with a lot of these systems is that they'll have a frontline provider, like you indicated, a nurse or someone like that who will get the alerts. And the nurse then may call you back and say, hey, Doris, I noticed that your weight went up 10 pounds from yesterday to today. Is there an issue? And I'm like, well, yeah, it was my birthday yesterday, so I ate a whole cake. Well, that's not something my provider really needs, that alert, right? So the nurses are usually your frontline triage. They're the one that the patient works with, especially in like care coordination and that kind of stuff. And then if it's an alert that needs a higher level, then that generally will go up to the provider. But that's one of the biggest issues that's a question right now, is how much data is too much data? And does a provider want all that data? And does the provider want all that data in your electronic health record? And if we're going to be getting huge influxes of data, how are we going to store that data? So there's a lot of questions around the whole data management system that we're still struggling with.
Yeah, I think that's a great call out, especially like as we move more towards devices, whether it's like an Apple Watch, et cetera. It's just, where's that data going to go and who's looking at it? There was another kind of on the demo theme. Rebecca had asked, like, do these results go usually right into the platform? I think she's meaning like, the organization or company that owns the device, or do they go right into the EHR?
Yeah, most of these are going to live in a cloud. So most of the results will go to the cloud portal. And then there can be EHR integrations for alerts or EHR integrations for reports that come out from that portal into the EHR, into the EMR. You don't want every single reading going into the vital sign statistics for your patient. It's just too much data and it'll kind of wash out the system. So kind of like Doris was saying, having that provider portal where the data lives is actually useful in that that's where you can kind of set up, manage that group, and then just push the information that's important to you into the EHR.
That's great. We had a couple more questions. Let's see. One from Megan. So she was asking, like, has there been any thought about training CHWs to be frontline tech support in the patient's home?
So with care coordination and care management services, you can many times have a staff person like a community health worker go into the home, work with the patient, make sure that they're taking the readings correctly. And those kinds of interactions will count towards that 30 minutes or 60 minutes of patient management for that month. So we see a lot of organizations that are building care management programs doing that kind of thing, because it's based on the number of minutes or hours that you are managing that patient in a month. The reimbursement is based on that. With chronic care management, CCM, and care management models. And so a lot of times they'll take somebody like a community health worker to do part of that patient management that can go towards the billable hours.
Yeah, and to add to that too, a lot of vendors have kind of the first line of technical support. So they won't manage kind of the results, but if someone is having a hard time connecting a particular device, they'll have a hotline or they'll have a service for the patient to actually call and to get that set up. And in some cases, we had instructions that kind of came in the package of how to set it up. And then if you are having issues, they gave you the number to call to the vendor directly, and they would walk you through that initial setup. So there's some of that happens from the vendor, but the care management, that can be something that you contract out. But a lot of organizations are wanting to handle that internally in order to be able to bill for those services.
Great. I think we have time for one more question. So this is from Nabil. So I was wondering if you could speak more about the fulfillment component business model and talk about some of the players in this space.
So one of the things that we've seen is that an organization will have the technology built into their electronic health record process. So a provider will see the patient. They will make a decision that they're going to do remote patient monitoring. They will then put in the patient's record in the EHR a prescription for the remote patient monitoring system. Then that prescription alerts to the vendor that they're working with. And we really can't give you names of vendors because we're vendor neutral, but there are several out there that work in that capacity. Then the vendor will get a hold of the patient and they'll say, Mrs. Barta, Dr. Cobb just got a hold of us and said that he wants to send the remote patient monitoring system to you. Is this the right address to send it? That way, then they know that they're going to be getting it, who they're going to be getting it from. Then they ship it out, and then they work with the patient in getting that technology up and running. What that does is it helps, and then it's a service, it's a purchase service, obviously, that the organization purchases that helps them, removes them one step from having to do technology management. And then somebody else asked about, do the vendors rent hotspots? No, generally it's the provider who will rent a hotspot if they want to have access into that home environment.
Great, thank you. This was a super informative conversation. I think just hearing your answer to the last question is great, that the provider doesn't have to be really tech savvy and getting their patients on remote patient monitoring. I want to thank everybody for participating in the chat and for joining us today for the tools for remote patient monitoring section. I hope you'll come back in about 30 minutes to listen on the next session. So thank you and have a great day.